Hello, I am Nurul Athar, PMP, CPHIMS and ITR certified, and welcome to CPHIMS Exam preparation video. In this video, I will cover Systems, Privacy and Security. It's come under Systems. CPHIMS aspirants are required to study following topics under Privacy and Security. First, participate in defining organizational privacy and security requirement, policies and procedure. Assess privacy and security risks. Mitigate privacy and security vulnerabilities. Ensure user access control according to established policy and procedures. Ensure confidentiality, integrity, availability of data. Define organizational role, for example, information security, physical security, and compliance. Develop data management control, for example, data ownership, criticality, security level, protection control, retention and distraction requirement, access control. Validate disaster recovery and business continuity plans. Coordinate privacy and security audits. And validate security feature in the evaluation of existing new systems. Definitions. Privacy, security, and confidentialities. Privacy is the right to keep information to oneself. Confidentiality is the right to keep information about oneself from being disclosed to others. Security in this context is the protection of sensitive health information. There are many technologies to maintain security, but human vigilance is also required. The HIPAA privacy and security rule spells out the requirement for the United States. HIPAA stands for Health Insurance, Portability and Accountability Act. Four rules of HIPAA. The four rules of HIPAA requirement. Like the four horsemen, these are the major pieces that govern what do you know and how you do it. Okay. HIPAA privacy rule, HIPAA security rule, HIPAA enforcement rule, and HIPAA breach notification rules. Developers need to focus on technical and physical safeguards outlined in security rules. Healthcare providers modernize their medical record keeping and billing system. The adoption of electronic health record (EHR) and other innovation offer opportunity for improved patient care and more efficient practice management. However, as growing quantities of personal medical information are stored in electronic format, protecting the privacy and security of this data and ensuring the integrity of ePHI is critical. In addition, ensuring the integrity, privacy and security of sensitive data will be critical to the successful administration healthcare organizations. Okay. Based on understanding of requirement, top management will develop policies and procedures in support of organizational objectives. Policies describe an organization's role and regulation. Procedure provided stepwise accounting of how tasks are to be performed in order to ensure compliance with policies. Okay. Together, policies and procedure can be thought of as an organization endeavor to put down in writing the rules and process that its employee and business partners should follow. Okay. Guide to privacy and security, electronic health information. I have taken this information from following source: www.healthit.gov. Okay. The Office of National Coordinator for Health Information Technology provide resources to help you succeed in your privacy and security responsibilities. This guide to privacy and security of electronic health information, referred to as guide, is an example of just such a tools. Okay. This guide describes introduction and purpose. Why do privacy and security matters? Your practice and HIPAA roles, patients' right and your responsibility, understanding electronic health record, the HIPAA security role and cybersecurity, meaningful use, simple 7-step approach for implementing a security management process, and breach notification, HIPAA enforcement and other laws and requirements. Let's see the first topic, introduction and purpose. Everyone has a role in the privacy and security of electronic health information. It is truly a shared responsibility. The intent of this guide is to help care providers, especially Health Insurance, Portability and Accountability Act covered entities, C, and Medicare eligible professional EPs from smaller organizations better understand how to integrate federal health information privacy and security requirements into their practice. This new version of guide provides updated information about compliance with the Medicare and Medicaid electronic health record incentive program, privacy and security requirement, as well as the HIPAA privacy, security, and breach notification rules. Okay. The U.S. Department of Health and Human Services (HHS) via ONC, Office of National Coordinator, the Center for Medicare and Medicaid Services (CMS), and the Office of Civil Rights (OCR) support privacy and security through a variety of activities. These activities include the meaningful use of certified EHRs, the Medicare and Medicaid EHR incentive program, enforcement of HIPAA rules, and release of educational resources and tools to help providers and hospitals mitigate privacy and security risks in their practice. Action and programs. Okay. The HIPAA privacy, security, and breach notification rule, as updated by the HIPAA Omnibus Final Rule in 2013, set forth how certain entities, including most healthcare providers, must protect and secure patient information. They also address the responsibilities of business associates (BA), which include EHR developer working with healthcare providers. In 2011, CMS initiated the Medicare and Medicaid EHR incentive program. The programs are referred as EHR incentive program or meaningful use. Programs throughout this guide, meaningful use, encourage healthcare organizations to adopt EHR through a staged approach. Each stage contains core requirements that provider must meet. Privacy and security are included in the requirement. Federal and organizations within Health and Human Services (HS) that have a distinct health information technology role. Federal office agencies, health IT related responsibilities, and this is the website. Center for Medicare and Medicaid Service (CMS) oversees the meaningful use program. Agency name, Office for Civil Rights (OCR). Their responsibility administers and enforces the HIPAA privacy, security, and breach notification rules, conduct HIPAA compliant investigation, compliance reviews, and audit. This is website hs.gov/OCR. An Office of National Coordinator for Health Information Technology (ONC) provides support for the adoption of promotion of EHR and health information exchange, offer educational resources and tools to assist providers with keeping electronic health record information private and secure. This is the website www.healthit.gov. Okay. A fourth federal entity mentioned in this guide is the National Institute of Standards and Technology, NIST, an agency of the U.S. Department of Commerce. NIST sets computer security standards for the federal government and publishes reports on topics related to information technology security. While the reports are intended for federal government, they are available for public use and can provide valuable information to support a strong security program for your practice settings. Now let's see, why do privacy and security matters? The promises of digital health information to achieve better health outcome, smarter spending, and healthier people providers and individuals alike must trust that individual health information is private and secure. If your patient lack trust in electronic health record and health information exchange, feeling that the confidentiality and accuracy of their electronic health information is at risk, they may not want to disclose health information to you. Withholding their health information could have life-threatening consequences. Okay. To help cultivate patient trust, you should maintain accurate information in patient record. Make sure patients have a way to request electronic access to their medical record and know how to do so. Carefully handle patients' health information to protect their privacy. Ensure patients' health information is accessible to authorized representative when needed. Protecting patient privacy and securing their health information stored in eHR is a core requirement of the Medicare and Medicaid eHR incentive program. The eHR incentive program are also referred to as meaningful use. Your practice, not your eHR developer, is responsible for taking the steps needed to protect the confidentiality, integrity, and availability of health information in your eHR. Now let's see the next topic. Your practice and HIPAA role, health insurance, portability, and accountability rules. The Health Insurance Portability and Accountability Act, HIPAA rule, provide federal protection for health information held by covered entities and business associates and give patients an array of rights with respect to that information. Some definitions. What is covered entities and what is business associates? Okay. Who come under covered entities? Healthcare providers who conduct certain standards, administrative and financial transactions in electronic form, including doctors, clinics, hospitals, nursing homes, and pharmacies. Any healthcare providers who bills electronically, such as current Medicare providers, is a CA. Covered entities. Business associates. A business associate is a person or entity who is not member of the workforce and perform or assist in performing for or on behalf of covered entities. Examples of covered entities. Example of business associate include health information organization or exchange, HIO or HIEs, e-prescribing gateways, other persons who provide data transmission services that involve routine access to protected health information to a covered entity, a subcontractor to a business associate that create, receive, maintain, and transmit protected health information on behalf of business associates. An entity that covered entity contract with to provide patient with access to a personal health record or on behalf of covered entity. The suite regulation include this suite of regulation include the privacy rule, security rule, breach notification rule. Covered entity must comply with HIPAA privacy and security breach notification rules. Business associate, business associates must comply with HIPAA security rule and breach notification rule as well as certain provision of HIPAA privacy rules. Whether patient health information is on a computer, in an electronic health record, on paper, or in other media, providers have responsibilities for safeguarding their information by meeting the requirements of the rules. Let's explore privacy rule further. Which protect the privacy of privacy rule, which protect the privacy of individually identifiable health information. The privacy rule protects most individually identifiable health information held or transmitted by a covered entity or its BA business associate in any form or media, whether electronic, paper, or oral. The privacy rule call this information protected health information or PHI. Individually identifiable health information is information including demographic information that relates to individual past, present, or future physical or mental health or conditions, the provision of health care to be individual, or the past, present, or future payment for the provision of health care to the individual. C. Covered entities and B. A business associate must comply with HIPAA rules. HIPAA privacy rules. The privacy rule establishes national standards for the protection of certain health information. The privacy rule standards addresses the use and disclosure of protected health information as well as standards for individual privacy right to understand and control how their health information is used and shared, including rights to examine and obtain a copy of their health records as well as to request correction. Security rules. I will repeat it again. I have already covered, but I will repeat it again. Which set national standard for the security of electronic protected health information ePHI. Breach notifications, which require covered entities and businesses which are BA to provide notification following a breach of unsecured protected health information. C. Covered entity must comply with HIPAA privacy and security and breach notification rule. Business associates must comply with HIPAA security rules and breach notification rule as well as the certain provision of health privacy rule. Whether patient health information is on a computer, in electronic health record, on paper, or in other media, providers have responsibilities for safeguarding the health information by meeting the requirement of rules. Now let's see the next topic, patient rights and your responsibilities. Notice of privacy practice NPP. If you are covered entity, you must provide your patient with notice of your privacy practice. Your notice must contain certain elements including description of how your practice may use or disclose, share an individual protected health information. A specification of individual rights, including the right to complain to the U.S. Department of Health and Human Services and to your practice if they believe their privacy right have been violated. Many of these rights are also described in the next section, upcoming sections. Okay, patient access to information. Patients have right to inspect and receive a copy of their protected health information in a designated record set, which include information about them in your medical and billing records. Designated set records. Okay, what is designated set records? A designated record is a set. Okay, a designated record set is a group of records that your practice or your business associate maintain to make decisions about individual. For healthcare providers, the designated record set include, but is not limited to, a patient medical record and billing record. Covered entities are responsible for determining what record must be included as a part of designated record sets. Okay. Next, patient rights and your responsibility. Amendment of patient informations. Under HIPAA rules, patients have the right to request that your practice amend their protected health information in a designated record set. Okay. Next, patient right and your responsibility. Accounting of disclosure. Individuals have right to receive an accounting of disclosure of their protected health information made by your practice to a person or organization outside of your practice. An accounting of disclosure is a listing of the name of the person or entity to whom the protected health information was disclosed, date on which the protected health information was disclosed, description of the protected health information disclosed, purpose of the disclosure. Okay. Now next, patient right and your responsibility. Right to restrict information. Individuals have the right to request that your practice restricts certain use and disclosure of protected health information for treatment, payment and healthcare operation. Disclosure to person involved in the individual healthcare or payment for healthcare. Disclosure to notify family member or others about the individual's general condition or location of death. Next, patient right and responsibility. Right to confidential communications. Your practice must accommodate reasonable requests by your patient to receive communication from you by the mean or at the location they specify. For example, they may request that appointment reminder be left on their work voicemail rather than home phone voicemail. Now let's see the next topic. Understanding electronic health record, the HIPAA security rule and cybersecurity. Okay. The HIPAA security rule, how to keep your patient health information secure with an eHR, working with your eHR and health IT developers and cybersecurity. Okay, let's explore the HIPAA security rule. Okay. The Health Insurance Portability and Accountability Act HIPAA security rule establishes a national set of minimum security standard for protecting all electronic protected health information that a covered entity and business associate create, receive, maintain or transmit. The security rule contains the administrative, physical and technical safeguard that covered entity and business associate must put in place to ensure secure electronic protected health information. Okay. Administrative safeguard, physical safeguard, organizational standards and policies and procedures. Let's see the first, administrative safeguard. Administrative safeguards are administrative action, policies and procedure to prevent, detect, contain, and correct security violation. Administrative safeguard involve the selection, development, implementation, and maintenance of security measures to protect electronic protected health information and to manage the conduct of workforce member in relation to the protection of that information. A central requirement is that you perform a security risk analysis that identifies and analyzes the risk to electronic PHI and then implement security measure to reduce the identified risk. Physical safeguard. These safeguards are physical measures, policies and procedures to protect electronic information system and related building and equipment from natural and environmental hazards, unauthorized intrusion. These safeguards are the technology and the policies and procedures for its use that protect ePHI and control access to it. ePHI stands for Electronic Protected Health Information. Organizational standards. These standards require a core entity to have a contract to other arrangement with business associates that will have access to covered entities ePHI, Electronic Protected Health Information. The standards provide the specific criteria required for written contract or other arrangement. Policies and procedures. These standards require a covered entity to adopt reasonable and appropriate policies and procedures to comply with the provision of the security rule. A covered entity must maintain until 6 years after the date of their creation or the last effective date, whichever is later, written security policies and procedure and written record of required action, activities or assessments. A covered entity must periodically review and update its documentation in response to environmental or organizational changes that affect the security of ePHI, Electronic Protected Health Information. Now let's see how to keep your patient health information secure with an electronic health record. To uphold patient trust, your practice continues to adopt and use electronic health record or other electronic technology for collection and use of ePHI and to comply with HIPAA security rule and meaningful use requirement. Your practice must conduct a security risk analysis, sometimes called security risk assessment. Working with the EHR health IT developers. When working with EHR and health information technology developer, you may want to ask the following question to help understand privacy and security practice they put in place. When my health IT developer installs its software for my practice, does its implementation process address the security feature listed for my practice environment? Okay. ePHI encryption to auditing function, backup and recovery routine, unique user ID and strong password, role or user-based access control, auto timeout, emergency access, amendment and accounting of disclosure. Will the health IT developer train my staff on the above feature so my team can update and configure this feature as needed? How much of my health IT developers training core privacy and security awareness requirement and functions? How does my backup and recovery system work? Where is the documentation? Where are the backups stored? How often do I test this recovery system? When my staff is trying to communicate with the health IT developers staff, how will each party authenticate its identity? For example, how will my staff know that an individual who contacts them is the health IT developer representative and not a hacker trying to pose as such? How much remote access will health IT developer have to my system to provide supports and other services? How will this remote access be secured? If I want to securely email with my patient, will the system enable me to do that? That is required by security rule. Consumers increasingly want to communicate electronically with their providers through email or texting. The security rule requires that when you send ePHI to your patient, you send through a secure method and that you have a reasonable belief that it will be delivered to the intended recipient. The security rule, however, does not apply to the patient. A patient may send health information to you using email or texting that is not secure. The health information becomes protected by the HIPAA rule when you receive it. What is encryption? Encryption is a method of converting an original message of regular text into encoded text. The text is encrypted by means of an algorithm, a type of formula. If information is encrypted, there is a low probability that anyone other than the receiving party who has the key to the code or access to another confidential process would be able to decrypt the text and convert it into plain comprehensible text. Now let's see cybersecurity. Cybersecurity refers to a way to prevent, detect, and respond to attack against or unauthorized access against a computer system and its information. Cybersecurity protects your information or any form of digital assets stored in your computer or in any digital memory device. Okay. An internet connection is necessary to conduct the many online activities that can be a part of electronic health record and ePHI uses. Exchanging patient information electronically, submitting claims electronically, generating electronic record for patient request and e-prescription are all examples of online activity that rely on cybersecurity practice to safeguard system and information. It is important to have a strong cybersecurity practice in place to protect patient information, organizational assets, your practice, operation, and your personal and of course to comply with HIPAA security rule. Okay. Security is needed whether you have your EHR locally installed in your office or access it over internet from a cloud service provider. Now let's see what is meaningful use. In the Medicare and Medicaid Electronic Health Record (EHR) incentive program, also called Meaningful Use program, the Center for Medicare and Medicaid Services (CMS) sets states requirement for providers to demonstrate progressively more integrated use of EHR and receive incentive payment for such use. This updated guide focus on stage 1 and stage 2 core objective that address privacy and security, but it does not address menu objectives, clinical quality measure, or stage 3. General overview of stage 1 and stage 2 meaningful use. Okay, meaningful use must be demonstrated by using the capabilities of certified eHR technology. Okay, CEHRT. Okay, certified CHRT stands for Certified Electronic Health Record Technology. Okay, adopted by U.S. Department of Health and Human Services (HS) as the standards. Implementation, specification, and certification criteria in the Office of National Coordinator for Health Information Technologies is standard and certification criteria, regulation, and meeting CMS defined criteria through a phased approach based on anticipated technology and capabilities development. Okay. The stage 1 meaningful use criteria consistent with the other provision of Medicare and Medicaid law focuses on electronically capturing health information in a structured format, using the information to track key clinical conditions and communicating that information for care coordination purpose, whether that information is structured or unstructured, but in structured format whenever feasible. Implementing clinical decision support tools to facilitate disease and medication management, using eHR to engage patients and families. And reporting clinical quality measure and public health information. Okay. Stage 2 meaningful use criteria consistent with other provision of Medicare and Medicaid law, expanded upon the stage 1 criteria to encourage use of health information technology for continuous quality improvement at the point of care and exchange of information in most structured format possible. Examples of such use include the electronic transmission of order using computerized provider order entry (CPOE), and electronic transmission of diagnostic test results such as blood test, microbiology, urine analysis, pathology test, radiology, cardiac imaging, nuclear medicine test, pulmonary function test, genetic test, genomic test, and other such data needed to diagnose and treat disease. Both meaningful use stage 1 and stage 2 require participating provider to attest that they have met certain objective and measure regarding the use of electronic health record for patient care. This attestation is effectively your confirmation or a statement that your practice has met this requirement. Basic cyber security practices are needed to protect confidentiality, integrity, and availability of health information in eHR system. These protections are essential whether the eHR is installed on server in your office or hosted on behalf by developer or internet. Now see sample 7-step approach for implementing a security management process. Step 1. Lead your culture, select your team and learn. Step 2. Document your process, finding and action. Review existing security of ePHI, perform security risk analysis, develop an action plan, manage and mitigate risk. Step 6. Attest for meaningful use security related objective. And step 7, monitor, audit and update security on an ongoing basis. Let's explore first. Lead your culture and select your team and learn. First, designate a security officer. Discuss HIPAA security requirement with your eHR developer. Consider using qualified professional to assist with your security risk analysis. Use tools to prove your security risk analysis. Refresh your knowledge base of the HIPAA rules. Promote a culture of protecting patient privacy and security patient information. Okay, let's explore this in detail. Designate security officers. Okay, a security officer is responsible for protecting your patient ePHI from unauthorized access by working effectively with others to safeguard patient information. At various times, the officer will need to coordinate with your privacy officer if a different person, practice manager, information technology administrator or consultant, your eHR developer and legal counsel. When you designate your security officer, be sure to record all officer assignment in a permanent documentation file. This file should focus on HIPAA compliance effort even if you are the officers. Discuss your expectation for the officer and his or accountability. Note that you as a covered entity retain ultimate responsibility for HIPAA compliance. Enable your designated officer to develop full understanding of the HIPAA rules so they can succeed in their role. For example, allow them time to participate in privacy and security presentation, seminars and webinar, and to read and review the final rules and the analysis and summaries on the Office of ONC Health, IT Privacy and Security Resources web page, including the helpful OCR audit protocol. Have them use the ONC Cybersecurity training game as a useful training tools. Now let's see the second topic. Discuss HIPAA security requirement with your electronic EHR developer. Okay, electronic health record developers. As you prepare for the security risk analysis, meet with your EHR developer to understand how your system can be implemented in a manner consistent with HIPAA requirement and those for demonstrating stage 1 and stage 2 meaningful use. Before you purchase an EHR, perform your due diligence by discussing and confirming privacy and security compliance requirement and conduct capability. Refer to the listing of CHRT developers as you proceed. If you have implemented an EHR, confirm your practice understanding of the overall function that your EHR product offer and then assess your current security settings. You would want to make sure that EHR system can be configured to your policies and procedure and that the EHR will sign a business associate agreement BAA that reflect your expectation. Confirm any planned additional capabilities that you need or that your EHR developer is responsible for providing, especially if you are required to demonstrate meaningful use. Ask the developer for its pricing for training staff on those functions, developing relevant policies and procedure, and correcting security setting deficiency in the EHR system. Now let's say consider using qualified professional to assist with your security risk analysis. Your security risk analysis must be conducted in a manner consistent with the HIPAA security rule, or you will lack the information necessary to effectively protect ePHI. Note that doing the analysis in-house may require an upfront investment of your time and staff members' time to understand and address electronic information security issues and the HIPAA security rules. A qualified professional expertise and focused attention can often yield quicker and more reliable result than if your staff does an in-house risk analysis in a piecemeal process spread over several months. Certification can be one indicator of qualification. The professional will suggest ways to mitigate risk so you can avoid the need to research and evaluate options yourself. Security certification, certification in health information security. Some professionals have a certification in health information. For example, the Health Information and Management System Society (HIMSS) and American Health Information Management Associations are two organizations that offer certification upon successful completion of an exam. Certified Healthcare Privacy Security Officer (CHPS). This credential is designated to professionals who are responsible for safeguarding patient information. This credential signifies expertise in planning, executing, administrating privacy and security protection program in healthcare organization and competence in specialized skills set in privacy and security aspects of health information management. Certified Professional in Health Information Management System Society (CPHIMS). CPHIMS is a professional certification program for healthcare information management system professionals. The International Information System Security Certification Consortium, or ICSC, is a non-profit organization which specializes in training and certification for cybersecurity professionals. Certified Information System Security Professional (CISSP). The CISSP is an objective measure of excellence. It is the most globally recognized standard of achievement in the industry, and this cybersecurity certification was the first information security credential to meet the strict condition of ISO IEC standard 17024. Healthcare Information Security and Privacy Practitioner HICSPP. This global healthcare security certification proves you have what it takes to implement, manage, and assess the proper security privacy control to protect healthcare organizations. Now let's move to the next topic. Use tools to prove your security risk analysis. Have your security officer or security risk professional consult use tools available on the ONC and OCR website to get a preliminary sense of potential shortcoming in how your practice protects patient information. A single listing of areas of focus on or a checklist does not fulfill the security risk analysis requirement, but these types of tools will help everyone get ready for needed improvement. Consider the SRA tool and OCR guidance on risk analysis for more thorough guidelines in evaluating your level of risk. Refresh your knowledge base of the HIPAA rules. Learn about HIPAA rules, state laws, and other privacy and security requirements that also require compliance. Promote culture of protecting patient privacy and securing patient information. Privacy and security are best achieved when the overall atmosphere in your office emphasizes confidentiality, protecting of patient information. Culture set the tone that will consistently communicate with your expectation that all members of your workforce protect patient health information. guide your workforce to guide your workforce effort to comply with, implement, and enforce your privacy and security policies and procedure. Remind your staff why securing patient information is important to patient and medical practice. Now we'll see, okay, under simple 7-step approach for implementation security management process. Now we'll move to the second topic. Document your process, findings, and action. Documentation of risk analysis, HIPAA-related policies, procedures, reports, and activities requirement under the HIPAA security rule. Also, the Center for Medicare and Medicare Services (CMS) advise all providers who attest for ePHI incentive program to retain all relevant records that support attestation. Documentation shows how you did the security risk analysis, implemented safeguard to address the risks identified in your risk analysis. See the box at right for additional item to include in your documentation folders. Okay. Over time, your security documentation folder will become a tool that help your security procedures to be more efficient. Your workforce will be able to reference this master file of security finding, decision, and action. Further, the information will be more accurate than if your workforce tries to reconstruct past decisions and actions. This record will be essential if you are ever audited for compliance with the HIPAA rules or ePHI incentive programs. Okay, example of record to retain. Contents would include but not limited to the following. Okay. Your policies and procedures, completed security checklist, training material presented to staff and volunteers, any associated certificate of completion, updated business agreements, security risk analysis report, electronic health record audit logs that shows both utilization of security features and effort to monitor user action, risk management action plan or other documentation that shows appropriate safeguards are in place through your organization, implementation timetables and implementation notes, security incident and breach notification. Okay, now we'll see the step third. Review existing security of ePHI, perform security risk analysis. The risk analysis process assesses potential threats and vulnerabilities to the confidentiality, integrity, and availability of ePHI. The findings from this analysis inform your risk mitigation strategy. These are recommended resources can provide guidance on your security risk analysis. OCR Office, okay. OCR Office of Civil Rights guidance on risk analysis requirement under HIPAA security rule. OCR security rule frequently asked questions. SRA tools which help small practice conduct an extensive systematic risk analysis. National Institute of Standard Technology NIST HIPAA security rules toolkit. Your first comprehensive security risk analysis should be follow a systematic approach that covers all security risks. It should identify where ePHI exists in your practice and how it's created, receive maintained and transmitted, including in your EHR. Types of risks to the ePHI maintained in your EHR will vary depending on whether your EHR is based in your office or hosted on the internet, for example, cloud-based or application service provider. Identify potential threats and vulnerabilities to ePHI. Potential threats include human threats such as cyber attack, theft, or workforce member error, natural threats such as earthquake, guide to privacy and security of electronic health information, fire or tornado, and environmental threats such as the pollution or power loss. Vulnerabilities or flaws or weaknesses that, if exploited by a threat, could result in a security incident or violation of policies and procedures. Identify risk and their associated level, for example, high, medium, low. This is done by assessing the likelihood that threat will exploit vulnerabilities under the safeguard currently in place by assessing the potential impact to confidentiality, integrity, and availability of ePHI. Security risk in office-based EHR versus internet-hosted EHR. All types of EHR outperform paper medical record when it's come to providing better access to and use of ePHI. On the other hand, EHR also introduce new risks to ePHI. ePHI stands for Electronic Protected Health Information. The mix of security risk is affected in part by the type of EHR hosting you have: office-based, local host, or internet-hosted, remote host. Example of potential information security risk with different types of EHR. We'll see office-based EHR. Host type, office-based EHR. Risk: natural disaster could greatly disturb the level of and even destroy ePHI. Okay. Mitigation steps: always store routine backup offsites. Risk: you directly control the security settings. Risk: regardless of what is the mitigation steps? Regardless of your practice size, follow best practice on policies and procedure about access to ePHI. For example, use password control and automatic logout features. Risk in office-based host type: the security feature on your office-based EHR may not be up to date and sophisticated as an internet-hosted EHR. Mitigation step: maintain ongoing communication with your EHR developer about new features and their criticality to the security of EHR. Okay. Host type, office-based. Risk: when public and private information security requirement change, you have to figure out how to update your EHR and work out any bugs. What is the mitigation steps? Routinely monitor for changes in federal, state, or private sector information security requirement and adjust setting as needed. Internet hosted EHR, cloud-based EHR. What is risk and what is mitigation steps in cloud-based EHR? You are more dependent on reliability of your internet connection. Your data may be stored outside the US, and other countries may have different health information privacy and security laws that may apply to such offshore data. Mitigation steps: confirm that EHR host follows US security standard requirement. The developer may control many security settings. Mitigation steps: the adequacy of this setting may be hard to assess, but ask for specific information. Risk: in the future, developer might request extra fees to update your EHR for compliance as federal, state, and private sector information security requirements evolve. Mitigation step: ensure EHR stay compliant before you buy. It's okay to ask your developer about fee. It may charge for security update. Now we'll move to step 4. Develop an action plan. Using the result from risk analysis, discuss and develop an action plan to mitigate the identified risk. Your action plan is informed by your risk analysis and should focus on high priorities, threats, and vulnerabilities. Take advantage of the flexibility that HIPAA security rule provide, which allow you to achieve compliance while taking into account the characteristic of your organization and its environment. It is important that your security plan is feasible and affordable for your practice. Often basic security measure can be highly effective and affordable. Action plan components. Plan should have 5 components. Okay, the plan should have 5 components. Administrative safeguard, physical safeguard, technical safeguard, organizational safeguard, policies and procedures. We'll see the first safeguard, administrative safeguards. Okay, administrative safeguard, security component, administrative safeguard. Example of vulnerabilities: no security officer is designated, workforce is not trained or unaware of privacy and security issues, periodic security assessment. Okay, example of security mitigation strategies: security officer is designated and publicized, workforce training began at higher and is conducted on regular and frequent basis, security risk analysis is performed periodically and when change occur in the practice or the technology. Physical safeguard. Security component, physical safeguard. Example of vulnerabilities: facilities has insufficient lock and other barrier to patient data access. Computer equipment is easily accessible by public. Portable devices are not tracked or not looked up when not in use. Example of security mitigation strategies: building alarm systems are installed, offices are locked, screens are shielded from secondary viewers. Now we'll see the technical safeguard. Security component, technical safeguard. Example of vulnerabilities: poor control allow inappropriate access to ePHI. Audit logs are not used enough to monitor user and other ePHI activities. No measures are in place to keep electronic patient data from improper changes. No contingency plan exists. Electronic exchange of patient information are not encrypted or otherwise secure. Okay. Example of security mitigation strategies: secure user ID and password, and appropriate role-based access are used. Routine audit of access and changes to ePHI are conducted. Anti-hacking and anti-malware software is installed. Contingency plan and data backup plan are in place. Data is encrypted. Okay. Security component, organizational standards. Example of vulnerabilities: no breach notification and associated policies exist. Business associate agreement have not been updated in several years. Example of security mitigation strategies: regular review of agreement are conducted and updated made accordingly. Okay, security component, policies and procedures. Example of vulnerabilities: generic written policies and procedure to ensure hypersecurity compliance were purchased but not followed. The manager perform ad hoc security measure. Example of security mitigation strategies: written policies and procedure are implemented and staff is trained. Security team conduct monthly review of your of user activities, routine updates are made to document security measures. For any single risk, a combination of safeguards may be necessary because there are multiple potential vulnerabilities. For example, ensuring appropriate continuous access to patient information may require something as simple as physical safeguard of adding a power surge protection strips, putting the server in locked room, and being meticulous about backup. Your action plan should have multiple combination of the 5 required components. Although the steps are sequential, the security components are interrelated. Low cost, high effective safeguards. Say no to staff request to take home laptop containing unencrypted ePHI. Remove hard drive from old computers before you get rid of them. Don't put email ePHI unless you know the data is encrypted. Make sure your server is in a room accessible only to authorized staff and keep the door locked. Make sure the entire office understands that passwords should not be shared or easy to guess. Notify your office staff that you are required to monitor their access randomly. Maintain a working fire extinguisher in case of fire. Check your EHR server often for virus and malware. Processes for developing the plan. Your security officer will need to convene the team to develop the security action plan. Begin by identifying the simple action that can reduce the greatest risk. Once the plan is written, your designated security team should meet periodically to coordinate action, walk through unexpected snags, and track progress. Reward your team as it's achieved milestone. Understand that you will not able to eliminate risk, but you will be able to lower it by implementing safeguards that reduce risk and vulnerabilities. Okay, now I'll move to step 5, manage and mitigate risks. Once you have an action plan, follow it to reduce security risk and better protect ePHI. This step has 4 parts. First, implement your action plan, which includes using applicable EHR security setting and updating your HIPAA related policies and procedure. Prevent breaches by educating and training your workforce. Communicate with patient and update your BA contract. Let's see the first. The goal of the following your security risk action plan is to protect patient ePHI through ongoing effort to identify, assess, and manage risk. As discussed in step 4, your action plan, regardless of how it is organized, should address all 5 HIPAA security components: administrative safeguard, physical safeguard, technical safeguard, organizational standard, and policies and procedures. Information security setting in your EHR. Okay. If an EHR is certified, it has a package of core technical security functions such as the ability to authenticate user with valid account. However, use of certified electronic health record technology doesn't mean that your practice is HIPAA compliant. Certification does not guarantee performance or reliability of security function in CEHRT. especially if you turn off functions that are important to privacy and security rule compliance. The security function of CE certified electronic health record technology may be off, or the setting could be at a suboptimal level. Both can create vulnerabilities. Written policies and procedures. With respect to protecting patient information, your policies and procedures guide how your practice operate on day-to-day basis. Day-to-day basis. Your medical practice policies and procedures should accomplish the following at minimum. Establish protocol for all 5 security components: administrative, physical, and technical safeguard, organizational standard, and policy and procedure. Commit to HIPAA training program for all new staff when they are hired and on a regular basis for entire workforce. Instruct your workforce on what that to do when something happens that impairs the availability, integrity, or confidentiality of ePHI. Sometimes these instructions are labeled as incident response or breach notification and management plan. Specify a sanitation policy for violation of Specify a sanction policy for violation of the privacy, security, or breach notification rule. Your policies and procedure. Your action policy must be applied consistently as written. Detailed enforcement, starting with use of your ePHI security audit logs to monitor access, use, and disclosure of ePHI. Specify the need for written agreement with a business associate that their specific responsibility to comply with privacy and security. Once your written policies and procedure are in place, the HIPAA rules require that you do the following. Train your workforce, see step 5b, on what is required and how to implement the policies and procedure. HIPAA requires that your workforce be specifically trained on this policy and procedure, including breach notification. Your workforce will need periodic refresher training on new aspect of security program. Confirm that you have identified all your business associates. Contact them and confirm through written agreement that they understand their responsibility to carry out HIPAA rules requirement and to inform you of any breaches. Okay. Consistently apply your policies and procedure when unauthorized access to PHI occur. When a member of your workforce does not comply with your policies and procedure, he or she must be sanctioned. You must have a sanction policy in place to ensure all members of the workforce are treated fairly. Document your action. Periodically review your policies and procedures. Make sure that they are current and your practice adhere to them. Update your policies and procedures when change in your internal or external environment create new risk. Retain policies and procedure in your documentation folder for at least 6 years after you have updated or replaced them. State and private sector requirement may specify a longer time period for retention. Okay. Now I'll move them. Okay. Now we'll move to a step next part. This one. Prevent breaches by educating and training your workforce. Workforce education and training plus a culture that values patient privacy are a necessary part of risk management. All of your workforce members, employees, volunteers, trainees, and contractors supporting your office need to know how to safeguard patient information in your practice. Your training program should prepare your workforce to carry out their roles and responsibility in safeguarding patient health information and complying with HIPAA rules. Your HIPAA-related policies, your procedure including process to monitor security steps for breach notification, frequency of workforce training. Your practice must educate and train individual workforce member at a time each person is hired or contracted. Industry best practice suggests that the entire workforce should be trained at least once every year, and anytime your practice changes policies or procedure, systems, location, infrastructure, etc. It is particularly important that your workforce be trained on how to respond immediately to any potential security incident or an unauthorized disclosure of ePHI, because this situation may be breaches. Making protecting patient information part of your routine. Deliberately create a culture that emphasizes PHI confidentiality. You can do this in a number of ways, which include speaking often about importance of trust in the patient-provider relationship. Remind your workforce that patients expect your practice to be good steward of their health information. Continually remind the staff to safeguard patient confidentiality and security of ePHI, making sure that your staff has a copy of your policies and procedure for easy reference. Remind them to comply with those policies and procedure. Addressing staff questions and getting outside resources to help if you feel you need additional expertise with message delivery. Reassessing each workforce member's job function and enabling him/her to access only the minimum necessary health information as appropriate. And this steps 4. Now let's go to 5C. Communicate with patients. Your patient may be concerned about the confidentiality and security of their health information in an EHR. Don't wait for them to ask. Instead, provide them with information about EHR, especially the benefit of EHR can bring them as a patient. Reassure patient that you have a system to proactively protect the privacy and security of their health information. Your staff should be able to speak to the confidentiality and security of your EHR as well. To preserve good patient relation, follow your policy and procedure for communicating with patient and caregiver if breach of unencrypted PHI ever occurs. Multifaceted communication plan will help you avoid patient concern about their EHR privacy. Inform patient that you place a priority on maintaining the security and confidentiality of their health information. ONC, Office of National Coordinator, and other federal agencies have developed consumer education handout that you may want to use or adopt. Address patient individual health information rights, which include the right to access or obtain a copy of their electronic health record in an electronic forms. Educate patient about how their health information is used and may be shared outside your practice. In some cases, depending on state law and the nature of information you are sharing, you may need to obtain a patient permission, consent, or authorization prior to exchanging his or her health information. Notify affected patient and caregiver when breach of Patient relation on security issues should be an integral part of your overall patient engagement strategy. Fulfill your responsibility for patients' health information rights. In the future, expect more patients to ask how you handle their More patients will ask for their medical record, and some will want change made in their record as a part of HIPAA rules, and it's just too meaningful use. You must respond to these patient requests in particular. Patient can request copies and access their PHI in paper or electronic format, including from your EHR. Meaningful use core objective indicate that such ePHI held in EHR should be made available to patient upon request within 4 business days if being available to the provider. Patient can request correction and amendment to their PHI in their records. This is called right to amend and has always been part of the HIPAA rules. Now stage 2 meaningful use. Objective 9 requires you to respond to patient request to amend their ePHI that is in your EHR. Under privacy rule, a patient or another person or patients on behalf can ask his/her provider to restrict submission of his/her PHI to patient's health plan when the patient has paid in full for the healthcare service or item, and the provider must honor that request. To prepare for patient request, ask your EHR developer about ways to use your system to help you fulfill individual patient rights. For example, confirm that EHR capabilities are currently available and when additional capabilities will be available, such as amendment to and copies of their ePHI. Your developer or other expert constantly may ask Your developer or other expert consultant may also be able to assist you in implementing these features both in your EHR and your practice workflow. Ask your EHR developer to provide a step-by-step instruction or best practice guideline that include screenshots on how to perform this instruction, how to perform these actions. Once you have established a process and procedure on how to provide patients with a copy of their medical information from your EHR, develop an understanding of and procedure for what to do when patient asks you to modify or to amend their health information, restrict disclosure, or obtain report about prior disclosure. Okay, now let's see online communication with patients. If you plan to interact with patient via online platform, for example, testing a patient portal for your EHR or social media, you must meet the security rule and meaningful use standard for the securing messaging of ePHI. Okay. Update your business associate contract. Be sure to update all your business associate agreement to comply with HIPAA, privacy, security, and breach notification rules. Fully comply with relevant safeguard for PHI that they get from your practice. Train your workflow. Adhere to additional requirement for patient rights and breach notification. Throughout this process, continue your effort to build a culture that values patient health information and actively protect it. Once easy way to give your staff time to place once easy way to give your staff time to play ONC cyber security training games. The games are fun and engaging way to provide answer to many of the everyday question around safeguarding PHI. Okay, these games are fun and engaging way to provide answer to many of the everyday question around safeguarding PHI. Okay, you can play this game on these following websites. Link is also available in video description section of YouTube. Okay, now let's move to stage 6, attestation for meaningful use, security related objective. The ePHI incentive program provides incentive payment to eligible providers as they demonstrate adoption, implementation, upgrading, and meaningful use of certified health information technology. These meaningful use programs are designed to provide providers with health information technology transition and instill the use of ePHI to improve the quality, safety, and efficiency of patient health care. Providers can register for ePHI incentive program anytime, but attesting requires you to have made the meaningful use requirement for an ePHI reporting period. So only attest for any ePHI incentive program after you have fulfilled the security risk analysis requirement and have documented your efforts. Specifically, you should not attest until you have conducted your security risk analysis or reassessment and corrected any deficiencies identified during the risk analysis. Document these changes. When you attest to meaningful use, it is legal statement that you have met a specific standard, including that you protect electronic health information. Providers participating in ePHI incentive program can be audited. If you attest prior to actually meeting the meaningful use security requirement, it is possible you could increase your business liability for violating federal law and making a false claim. Consult with your appropriate legal counsel for further guidance. From this perspective, consider implementing multiple security measures prior to attesting. The priority would be to mitigate the high impact, high likelihood risk. Now let's see step 7. Monitor, audit, and update security on an ongoing basis. Okay, step 7 relates to HIPAA security rule requirement that you have audit controls in place and you have capability to audit. HIPAA uses the term audit in two ways. In the first context, audit is what you do to monitor the adequacy and efficiency of your security infrastructure and make needed changes. Okay. Okay. Have your security officer, IT administrator, and ePHI developer work together so your system monitoring audit functions are active and configured to your needs the way they want you to. Okay. Decide whether you will conduct the audit in-house, use an information security consultant, or have a combination of two. Determine what to audit and how the audit process will occur. Identify trigger indicators or sign that ePHI could have been compromised and further investigation is needed. Establish a schedule for routine audit and guidelines for random audit. In the second context, audit referred to an effort to examine what happened. This means your EHR must be set up to maintain retrospective documentation, for example, a audit log on who, what, when, and where, and how your patient ePHI has been accessed. Such audit, for example, the auditing process which would examine logs or require security technical capabilities that would be part of your stage 1 and 2 meaningful use demonstration. These capabilities include auditable events and tamper-resistant audit logs, access control and authorization, automatic log off, and emergency access. Your audit control and capabilities should be scaled to your practice size. For example, your certified EHR has a function to generate audit logs. This means it can record when, where, for example, which laptop, and how ePHI is accessed by whom, what the individual did, and for what purpose. Your EHR can then produce reports using these data. Such audit logs are useful tools for both holding your workforce accountable for protecting ePHI and for learning about unexpected or improper modification to patient information. Medical record retention. As you know, state law require you to store medical records for a specified number of years. Your obligation and length of time to maintain patient medical record in an EHR are usually also a matter of your state's medical record retention laws. These laws are often found in states' licensing laws. If one of your PA is an health information exchange, your written agreement with HI, Health Information Exchange, would require it to return or securely dispose of ePHI it creates, receive, maintain, or transmit on behalf of your practice, the covered entities, CE. Okay. Now we'll see breach notification, HIPAA enforcement, and other laws requirements. Covered entities and business associates that fail to comply with Health Insurance Portability and Accountability Act HIPAA rule can be receive civil and criminal penalties. Civil penalties. The Office for Civil Rights (OCR) is able to impose civil penalties for organizations that fail to comply with HIPAA rules. The potential civil penalties are substantial. Your good faith effort to be in compliance with HIPAA rule is essential. Criminal penalties. The U.S. Department of Justice investigate and prosecute criminal violation of HIPAA rule. Under HIPAA, the Justice Department can impose criminal penalties for knowing misuse of unique health identifier, knowing an unpermitted acquisition or disclosure of protected health information, the breach notification rule out what to do if you have a breach. A breach is generally an impermissible use or disclosure under the privacy rule that compromises security or privacy of PHI. An impermissible use or disclosure of unsecured PHI is presumed to be a breach unless the CE or BA demonstrate based on risk assessment that there is a low probability that the PHI has been compromised. When breach of unsecured PHI occurs, the rule requires your practice to notify affected individual, the Security of Health and Human Services (HS), and in some cases the media. Okay. The breach notification will require HIPAA code entities to notify individual and the Security of HSS (Health and Human Services) of the loss, theft, or certain other impermissible usage or disclosure of unsecured PHI. In particular, healthcare providers must promptly notify the security of HHS if there is any breach of unsecure PHI that affect 500 or more individuals, and they must notify the media if the breach affect more than 500 residents of a state or jurisdiction. If breach affect fewer than 500 individuals, the covered entity must notify the secretary and affected individual. Reports of breach affecting fewer than 500 individuals are due to the secretary no later than 60 days after the end of the calendar year in which the breach occurred. You can demonstrate through a risk assessment that there is a low probability that the use of disclosure compromise unsecure PHI. Then breach notification is not necessary. Please note that this breach-related risk is different from the periodic security risk analysis required by security rule. And if you encrypt your data in accordance with the OCR guidance regarding rendering data unusable, unreadable, or undecipherable, you may avoid reporting what would otherwise have been a reportable breach. Remember, encryption depends on a decryption key being kept highly confidential, so don't store it with the data or in a location that would compromise it. Comparison of secured and unsecured PHI. Secure PI, unauthorized, secured, protected health information. An unauthorized person cannot use, read, or decipher in any PHI that he or she obtain because your practice encrypt the information or clear, purge, or destroy media. For example, data storage device, film, laptop that is stored or recorded PHI. Shredded or otherwise destroy paper PHI, unsecured PHI. An unauthorized person may use, read, and decipher PHI that he/she obtained because your practice doesn't encrypt or destroy the PHI or encrypts PHI, but the description key also been breached. Risk assessment process for breaches. When you suspect a breach of unsecured PHI has occurred, first conduct a risk assessment in order to examine the likelihood that the PHI has been compromised. For you to demonstrate that a breach has not compromised PHI, your practice must conduct the risk assessment in good faith and by thoroughly assessing at least the 4 required elements listed next. The nature and extent of PHI involved in the use or disclosure, including the types of identifier and the likelihood that PHI could be re-identified. As noted before, if your practice has a breach of encrypted data and if you had followed a standard encryption specification, it would not be considered a breach of unsecured data and you would not have to report it. The unauthorized person who used the PHI or to whom the disclosure was made, for example, journalist, civilian, the likelihood that any PHI was actually acquired or viewed, for example, an audit trail, would provide insight. The extent to which the risk to the PHI has been mitigated, for example, promptly change encryption key. When performing this assessment, you should address each element separately and then analyze the combined 4 elements to determine the overall probability that PHI has been compromised. The conclusion from your assessment must be reasonable. You have the burden of demonstrating that use or disclosure of unsecured PHI did not constitute a breach. If this assessment indicates that there is low probability of compromised PHI, then the use or disclosure is not considered to be breach and no notification is necessary. Probability of compromised PHI breach notification is required. Reporting breaches. If you choose not to conduct the risk assessment, or if after performing the risk assessment outlined above you determine that breach notification is required, there are three types of notification to be made: to individual, to the Secretary of Health and Human Services, and in some case to the media. Investigation and enforcement of potential HIPAA rule violation. OCR, Office of Civil Rights, investigate upon receipt of complaint, breaches report, information provided by other agencies and the media. The HIPAA enforcement rule provides different penalties for each of 4 levels of culpability. Penalties for violation. Intent: did not know or could not have known. Minimum per incident $100 to $50,000. Annual cap for all violation 1.5 million. Intent: reasonable cause and not willful neglect $1,000 to $50,000. Annual cap for all violation 1.5 million. Willful neglect but corrected within 30 days. Minimum per incident $10,000 to $50,000. Annual cap for all violation 1.5 million. Willful neglect and not corrected within 30 days. Minimum per incident $50,000 and all violation 1.5 million. The other laws requirement. Besides HIPAA rules and high-tech meaningful use privacy and security related requirement, your medical practice may also need to comply with additional privacy and security laws and requirement. Table ahead provided a snapshot of these requirements. Your state Board of Medicine, State Association, Regional Extension Center (REC), and HIE Health Information Exchange Initiative also may have guidance. Okay, sensitive health information. Key point: some laws and framework recognize that particular health condition may put individual at higher risk for discrimination or harm based on that condition. Federal and some state laws require special treatment and handling of information relating to alcohol and drug abuse, genetics, domestic violence, mental health, and human immunodeficiency virus (HIV), acquired immunodeficiency syndrome Acts, applicable federal laws. 42 CFR Part 2, Confidentiality of Alcohol and Drug Abuse, Family Educational Right and Privacy Act (FERPA), and Title X of Public Health Service Act (Confidentiality). Laws requirement: adolescent minor health information. State and federal laws generally authorize parent or guardian access depending on age and health condition. For example, reproductive health, child abuse, mental health, and applicable state laws. Minors also have privacy protection related to their ability to consent for certain service under federal or state law. Applicable federal laws, FERPA, Family Educational Rights and Privacy Acts, and Genetic and Information Non-Discrimination Act, GINA. Title X Public Health Services Act. Okay. Note HIPAA Omnibus Rule clarified that covered entity may release student immunization records to a school without authorization if its state laws require a school to have immunization record and written or oral agreement must be documented. Private sector. A contracting health plan or payer may require additional confidentiality or safeguard. Okay, that brings us to the end of my presentation. Thank you for watching, and I hope you found it helpful in preparation for the CPHIMS exams.